Electrophysiology is a very exciting, relatively new field in cardiology, which deals with cardiac rhythm. And my role essentially is assessment of patients with various types of cardiac arrhythmia and the treatment options, whether interventional or non-interventional. Once I understand how much patients' daily living has been affected by this process, then I can advise them on how intensive or intrusive the treatment procedure could or should be. So it's very important for me to be able to make a correct decision as to what's the best option for treatment. Pretty much every aspect of the field is cutting edge, and it's very much dependent on new technologies. And I'm very excited to be able to work with my other colleagues in the field of cardiology. They're all extremely talented and knowledgeable in their field. We have access to a stereotaxis, which only very few places in the country altogether have access to. Has been fantastic. From 7 to 8 is my time to catch up with whatever I have to do with from previous night. And 8 o'clock I'm in the procedure room. And my procedures, again, depending on what type of procedure I'm doing, can last from 1 hour to 6-7 hours. Some of them predictable, some of them unpredictable. So it makes the scheduling a little bit unpredictable as well. At the end of the day, obviously, I come back, finish up the reports of the procedure I've done, and hopefully go home at some time late at night. I have a wife and a daughter, 6.5-year-old daughter, and although I spend most of my time actually in hospital as opposed to home just because of the nature of work I do, I make sure that when I go home I sort of set aside the work and I spend as much quality time I could with them. I like classical music. I play piano whenever I have time, and I like hiking and canoeing, and spending time with the family and going out. This practice of cardiology is generally extremely stressful for everybody, long hours every day, and complexity of procedure. And then we are also a teaching facility, so we have to teach the fellows and a lot of things to catch up with. What helps along the process is relying on your colleagues and having a collegial and fun environment. So at the end of the day, you feel that you accomplished something, and you know that if there is some problems in the horizon, you have somebody to ask. If you ask for help from one of your colleagues, they're ready and willing to help you. When I was in internal medicine, I was fascinated by how you can actually record electrical signal from the heart just by putting smaller stickers on the skin and recording that. And I did a rotation in electrophysiology, and I really loved it, so I decided to become an electrophysiologist. I can tell you that since last year alone, we had at least 3-4 new major development. As I mentioned, a few of them: Watchman, sub-Q ICD, CardioMEM, and now we have multi-point pacing, which Deborah will be one of the very few in the country who will be implanting this. So these are all very interesting things that are happening in our field. But a lot of this, that especially in our field in electrophysiology, is the quality of life, and it's extremely satisfactory to see a patient who's been disabled by their arrhythmia, or be atrial fibrillation, even simple ablations for supraventricular tachycardia, as in a patient who has been avoiding exercise because she thinks that every time that she goes on treadmill she's going to have this palpitation. So to see that change, and a lot of these patients are younger patients, so it makes a difference that is has impact for many decades in their life to come.